Did you know that every decade after the age of 30, we naturally lose between 3% and 8% of our muscle mass? That's right. And even more alarmingly, after 60, this process can accelerate to as much as 15% every 10 years. But here's the most surprising news. Recent research shows that up to 80% of this muscle loss in seniors isn't related to aging itself, but rather to habits we can control. Just imagine that difficulty getting out of a chair, the tiredness when climbing stairs, or the feeling that any effort seems doubled. All of this that many believe is normal for your age may actually be intensified by everyday mistakes you don't even realize. And the worst part? While you think you're taking good care of your health, some seemingly harmless habits are silently stealing your strength and independence. Today, I'm going to reveal the top 5 mistakes that are accelerating your muscle loss. And most importantly, I'm going to show you how you can correct them immediately, before it's too late. Because believe me, losing muscle isn't an inevitable destiny. It's a consequence of daily choices. And the good news? You can start reversing this process today with simple and accessible changes. I'm Dr. Alexander King, a specialist in longevity and quality of life in your golden years, helping you live longer and better with autonomy and vitality. Mistake number 1, inadequate diet, the silent sabotage. Have you ever stopped to think that your diet, even when it seems healthy, might be sabotaging your muscles? This is the first and perhaps most common mistake I see in my patients. The truth is that many follow restrictive diets or simply don't consume enough protein, the real fuel for muscle maintenance. Studies show that after 60, our body needs approximately 0.55 to 0.68 grams of protein per pound of body weight, almost twice what's recommended for young adults. Why? Because with aging, we develop what we call anabolic resistance, where our body becomes less efficient at using protein to build muscle. I'll tell you about Mrs. Mary Johnson, a 67-year-old patient who came to my office complaining of constant weakness. When analyzing her diet, I discovered that she was consuming only about 40 grams of protein per day, less than half of what she needed for her weight. She avoided red meat for fear of cholesterol and drastically reduced her consumption of eggs and dairy products. The result? Accelerated muscle loss, even while maintaining a diet she considered healthy. We implemented gradual changes, inclusion of protein sources in every meal, such as eggs for breakfast, chicken or fish for lunch, and a combination of legumes with cheese for dinner. In just 3 months, Mrs. Johnson reported significant changes, more strength in her legs, greater ease in climbing stairs, and even resumed her daily walks without getting tired easily. Another crucial point is the timing of protein intake. Distributing consumption throughout the day is much more effective than concentrating everything in a single meal. Ideally, each main meal should contain between 25 and 30 grams of high-quality protein. Do you usually consume protein in all your main meals? Or do you concentrate everything only at dinner? Many Americans do. And we can't forget the essential micronutrient for muscle health. Vitamin D, for example, is essential for proper muscle function, and studies show that up to 70% of older adults are deficient in this vitamin. Calcium, magnesium, and potassium also play crucial roles in muscle contraction and recovery. Remember, your muscle is a living tissue, constantly renewing itself. Without the proper nutrients, this renewal process is compromised, accelerating the loss of strength and lean mass. Have you ever felt that, even eating well, you continue to lose strength? It may be that your diet seems healthy, but it's not providing the specific nutrients for muscle preservation. Mistake number 2, the disguised sedentary lifestyle, when movement isn't enough. But doctor, I take my walks every day. This is a phrase I hear frequently in the office. And my answer always surprises. That's great for your heart, but it may not be enough for your muscles. Here's the second big mistake: confusing aerobic activity with strength training. Although walking, swimming, and other cardiovascular exercises are excellent for overall health, they don't provide the stimulus needed to effectively combat sarcopenia, age-related muscle. Let's understand something fundamental. Our muscles respond to the principle of progressive overload. In simple terms, they need to be challenged with resistance to strengthen and maintain their mass. Without this specific stimulus, even active people can lose muscle strength. Mr. Carl Smith's case is a perfect. At 72, he proudly walked 3 miles every day. However, he began to notice that despite all this activity, he had increasing difficulty getting up from the couch and carrying groceries. When we evaluated his routine, we identified the problem. The strength component was completely missing from his exercise. We then started with a simple resistance training program suitable for his age and condition, initially using only his own body weight and gradually adding small resistance. In 8 weeks, the difference was noticeable, not only in strength, but also in balance and posture. The American College of Sports Medicine recommends that older adults perform muscle strengthening exercises at least 2 to 3 times a week, working the major muscle groups. And we're not talking about lifting heavy weights in gyms. Simple exercises like standing up and sitting down from a chair without using your hands, 10-15 repetitions. Wall push-ups to strengthen arms and chest. Leg extension with elastic bands, stepping up and down a step, alternating legs, support for all these movements can be done at home with initial supervision from a qualified professional. Another frequently neglected aspect is balance and mobility work. With muscle weakening, the risk of falls increases dramatically, creating a vicious cycle. Fear of falling leads to reduced activity, which in turn accelerates muscle loss. Did you know that adequate muscle strength is one of the main protective factors against falls in seniors, and that the risk of falls decreases by up to 40% in older adults who practice strength exercises regularly? What kind of exercise have you included in your routine? Just aerobic activities, or also those that challenge your muscles with some type of resistance? Mistake number 3, neglected sleep. Muscle recovery time. Spending sleepless nights may seem like just a temporary inconvenience, but for your muscles, it represents a serious problem. This is the third crucial mistake many make, underestimating the impact of sleep quality on muscle preservation. During deep sleep, our body releases hormones essential for muscle recovery and growth, including growth hormone, GH. With aging, we naturally experience a reduction in the production of these anabolic hormones. When we add inadequate sleep to this, the result is a perfect storm for accelerating sarcopenia. Studies show that older adults with chronic sleep disorders have up to 40% higher rates of muscle loss compared to those who maintain regular, quality sleep. It is during nighttime rest that the main repair process of muscle fibers that were stimulated during the day. The story of Mrs. Lucy Peterson illustrates this point well. At 65, she followed all the recommendations for muscle preservation: a diet rich in protein, strength exercises 3 times a week, and adequate supplementation. However, her results were far below expectations. When we investigated further, we discovered that she slept an average of only 5 hours a night, often waking up several times and rarely reaching the deepest stages. We implemented a sleep hygiene protocol, establishing regular sleep and wake times, reducing exposure to blue light 2 hours before bed, creating a suitable environment, temperature, darkness, silence, and relaxation techniques. In just 1 month, Mrs. Peterson was able to increase her average to 7 hours of sleep with fewer interruptions. The impact on her strength gains was so significant that she even questioned whether we had changed her exercise program. Another frequently neglected factor is sleep apnea, a condition that affects up to 45% of adults over 60. In addition to the known cardiovascular risks, apnea causes constant micro-awakenings that prevent reaching the most restorative phases of sleep, directly compromising muscle protein synthesis. Excessive use of sleeping pills can also be problematic. Although they help induce sleep, many of them reduce the time spent in the deepest and most restorative phases, resulting in quantity without quality. Do you usually wake up feeling really rested? Or do you notice that, even sleeping an adequate number of hours, you continue to be tired during the day? How is your routine before bed? Have you created favorable conditions for restful sleep? Or do you maintain habits that may be harming this phase so important for your muscles? Mistake number 4, Medications that steal your strength, the hidden enemy in your medicine cabinet. This fourth mistake is one of the most surprising and, unfortunately, little discussed. Prolonged use of certain medications can significantly accelerate your muscle loss. Many people in their golden years take multiple medications to control chronic conditions, a medical practice known as polypharmacy. What is rarely mentioned during consultations are the side effects of these medications on muscle mass. Corticosteroids, for example, commonly prescribed for inflammatory conditions such as arthritis and asthma, can cause a condition called steroid myopathy when used for long periods. This condition is characterized by the accelerated degradation of muscle proteins, especially in the legs, leading to progressive weakness. Some cholesterol-lowering drugs, such as statins, can cause muscle pain and weakness in certain patients, a side effect that many mistakenly attribute to old age. Diuretics, used for hypertension and heart failure, can cause electrolyte imbalances that directly affect proper muscle function. I remember Mr. Anthony Davis, 73, who came to the office complaining of extreme muscle weakness that had arisen in the last 8 months. Upon reviewing his medication, I noticed that he had started using a high-dose statin along with a potent diuretic. After adjustments to the medication, made in conjunction with his cardiologist, the muscle symptoms improved substantially over weeks. Important note, never discontinue the use of prescribed medications without medical advice. The goal here is not to demonize essential medicines for your health, but rather to encourage a periodic review of all medications with your doctor, also considering the impacts on your muscle health. Another relevant point is the excessive use of analgesics and anti-inflammatory drugs. Although they provide temporary relief, frequent use can mask pain that would serve as warning signs during physical activities, potentially leading to muscle injuries from overload. Some diabetes medications can also influence muscle metabolism, especially those that affect insulin sensitivity, a fundamental hormone not only for glycemic control, but also for the transport of amino acids to muscle cells. Have you ever talked to your doctor specifically about the possible effects of your medications on your muscle strength? Have you noticed any change in your physical capacity after starting any treatment? Mistake cluster 5, chronic stress, the silent muscle destroyer. Finally, we come to the fifth mistake, perhaps the most underestimated of all, allowing chronic stress to settle into your daily life. This factor can be sabotaging all your efforts to maintain muscle, even if you are doing everything right in other aspects. When we live in a state of constant alert, our body maintains elevated levels of cortisol, a stress hormone. In short periods, cortisol is beneficial and natural, but when it remains chronically elevated, it becomes catabolic. That is, it promotes the degradation of tissues, including muscle. Studies show that people with chronically elevated cortisol levels have muscle loss rates up to 3 times higher, especially in their golden years, when our protection mechanisms are already naturally reduced. Mrs. Helen Miller, 69, faced a particularly stressful period caring for her husband with Alzheimer's. Despite following an adequate diet and trying to stay active, she noticed progressive weakness and visible muscle loss. Analyses showed consistent high cortisol levels. With the implementation of stress management techniques and the organization of support to share caregiving responsibilities with her husband, we saw a significant improvement in her body composition. Chronic stress not only elevates cortisol, but also interferes with other hormones essential for muscle maintenance, such as testosterone and IGF-1, insulin-like growth factor 1. In addition, we know that stressed people tend to sleep worse, compromising muscle recovery, make less suitable food choices, often reducing protein consumption, decrease levels of physical activity or perform it inconsistently, present low-grade chronic inflammation which interferes with muscle protein synthesis. It is interesting to note that stress not only affects biochemical aspects, but also behavioral ones. When stressed, we tend to breathe more superficially, reducing the oxygenation of tissues, including muscles. Our posture also changes, overloading certain muscle groups and weakening others, creating imbalances that accelerate the process of sarcopenia. Simple techniques like deep breathing, guided meditation, even for just 10 minutes daily. Walks in nature and enjoyable hobbies can make a significant difference. The important thing is to find methods that work for you and consistently integrate them into your routine. Can you identify signs of chronic stress in your day-to-day life? Constant tension, irritability, digestive problems, or difficulty relaxing can be indicators. What strategies do you use to manage your stress? Have you dedicated time to activities that truly relax you to renew your energy? We have reached the end of our journey through the 5 mistakes that may be accelerating your muscle loss without you realizing. Let's recap what we learned today. First, we saw how an inadequate diet in proteins and essential micronutrients can silently sabotage your muscles. Even when you think you're eating well, the quantity, quality, and distribution of proteins throughout the day make all the difference in preserving lean mass after 60. Next, we demystified the idea that any movement is enough. Although aerobic activities are important for cardiovascular health, only strength training can effectively curb sarcopenia. Remember, challenging your muscles with progressive resistance is essential, even with simple exercises done at home. We also discovered the crucial importance of quality sleep as a time for muscle recovery and growth. Without adequate rest, all other efforts to preserve muscle are compromised. Investing in good sleep hygiene is not a luxury. It's a necessity for those who want to age with strength and vitality. The 4th point alerted us to how certain medications may be stealing our strength silently. The periodic review of prescriptions with your doctor, also considering the impacts on muscle health, should be part of your healthcare plan. Finally, we addressed the devastating impact of chronic stress on muscle, not only for its direct biochemical effects, but also for the behavioral changes it promotes. Controlling stress is not only good for your mind, but fundamental for your muscle. The most important message I want to leave is that accelerated muscle loss is not an inevitable destiny. Even if you are already feeling its effect, there is still time to reverse the situation. With the correct adjustments in diet, adequate exercises, attention to sleep quality, conscious review of medications, and effective stress management, it is possible not only to preserve but even recover part of the lost strength. Remember, strong muscles mean much more than just physical appearance. They represent independence, mobility, balance, metabolic health, and protection against falls. Investing in the preservation of your muscle mass is investing in your quality of life and autonomy for the coming years. If this content was useful to you, don't keep this knowledge to yourself. Share this video with friends and family who may also be making these mistakes without realizing. Often a small change in habits can make all the difference in someone's life. Subscribe to the channel to receive more content on health and longevity with quality of life. Next week, I will bring a special video with a complete program of simple exercises that can be done at home to strengthen the main muscle group, especially developed for people over 60. Always remember, aging is inevitable, but aging with weakness is optional. You have the power to choose how you want to live your next years with strength, independence, and dignity. The decision starts today with small changes that will bring great results. I'm Dr. Alexander King, and I'm here to help you live longer and better. See you in the next video.